Hi, my name's Melanie Stranwick from Perceptive Software, and I'm here today to discuss achieving a paperless NHS with Mark O'Herlihy. Mark, since we last spoke, I'd love to understand from you what progress you're seeing. What's today's reality, and how far along would you say the NHS is in terms of achieving its paperless target?
So almost all NHS workers we surveyed see benefits in going paperless, with an average of 6 benefits being selected. Notably, half of all healthcare workers believe going paperless will have a positive impact on the department, and 2/3 think it will improve patient care. Improvement in the ability to share records is the most commonly perceived benefit amongst all NHS workers, where we've seen that 7 in 10 are in agreement. The majority of frontline staff, however, say the reduction in storage space, quicker access to data, and reduction in the number of lost records are among the key benefits. This really showcases the potential hands-on practicalities of going paperless. Speaking at the Health and Care Innovation Expo in Manchester this March, Hunt said that healthcare has barely scratched the surface of really the benefits that technology can provide.
Okay, so I understand that's the aim, but how about today's reality? What is the current landscape, and how far along would you say that the NHS is, in your experience of supporting them daily, in terms of driving towards its paperless target?
So, in brief, we're already seeing progress when it comes to a paperless NHS. Our study found that trusts already have an average of 55% of patient records digitised. The majority, which was almost 70%, have established a plan of action to realise the paperless initiative, with almost 80% saying they've budgeted for the implementation. But whilst the process has already started for many trusts, there's still plenty of work to be done to get to this paperless state.
That's interesting. So then Perceptive Software's research has highlighted some clear differences in opinion between the heads of trust versus the IT decision makers and the healthcare professionals over whether it's possible for the NHS to go completely paperless by 2018. So why do you think that's the case today?
So there is plenty of debate as to how much this will really improve NHS services, if it's even achievable, and if it's worth the cost of implementing new IT systems. A report by a Public Accounts Committee recently said that changes made towards a digital NHS system has not gone to plan, and some are saying it has been an expensive waste of time. So we wanted to understand what the people working within the NHS really think over and above the onlookers. As with too often in the past we've seen, it seems NHS IT initiatives have split workers' opinions, and this could be detrimental to the success of this NHS paperless programme. In terms of this initiative being touted as a waste of time, and industry commentators saying it has not gone to plan, our research showed how far the initiative has been deployed within hospitals across the UK. So to really look at some of these figures, according to the NHS heads of trusts, on average 58% of patients have digitised records, while clinical staff think almost 2/3, i.e. 65% of patient records are now digital. By contrast, NHS IT staff, who really should have the best view of the issue, believe it's much less than half. There's even further disparity with the research showing that over half of heads of trusts believe that being completely paperless by 2018 is a realistic goal, compared to less than a fifth of IT decision makers and healthcare professionals. I think there is no single standard. The Safer Wards, Safer Hospital guidelines set out the aims, but not the how. It is, however, very encouraging to see so many new cases in the press recently of forward movement in this field, such as 4 Southern acute trusts moving to an electronic prescribing and medicines administration system, and this shows a real determination to move forward.
Thanks for your time today, Mark. It's been most informative. I look forward to hearing more from you on this topic. For more information, please visit our website at www.perceptivesoftware.co.uk.